Hi, I'm Madeline.
And I'm Lexi.
Today we will be discussing Project Impact, as described in the article A Parent-Mediated Intervention for Children with Autism Spectrum Disorder, delivered in a community program, by Stadnick, Shamer, and Brookman-Fraze.
This article describes a parent-mediated intervention style in which speech-language pathologists help parents or caregivers improve their role as communication teachers to their children. Throughout the program, the parents will learn how to enhance their child's communication skills in the areas of social engagement, language, imitation, and play. The caregivers will practice modeling these behaviors in the session and receive feedback from the treating SLP before generalizing the skills into their home.
Project Impact is a great tool SLPs can use to promote social communication and spoken language in children on the autism spectrum. Parents play a valuable role in their children's early intervention process, and as SLPs, we need to equip these parents with the correct tools and strategies to enhance social communication in their children's everyday lives.
The purpose of this study is to research how effective Project Impact intervention is in a community-based setting by providing services for children with autism spectrum disorder and their family members. In order to analyze the intervention's effectiveness, researchers compared the child and parent outcomes between 16 parent-child dyads in the intervention group and 14 parent-child dyads in the comparison group, pre- and post-treatment, to see if there were any significant changes in the child's social communication skills as well as the parent's adherence to the intervention. Researchers also analyzed parent factors such as stress and depression levels before and after treatment was completed. The results from this study show that by using the Project Impact intervention, children in the intervention group had increased social communication skills when compared to the comparison group. Also, the parents in the intervention group had greater parent adherence than parents in the comparison group. The results also indicated for parents who had high stress levels at baseline, there was less of a change in children's social communication skills.
In our article, Project Impact Intervention was used along with Naturalistic Developmental Behavioral Intervention, or NDBI strategies, in order to foster the child's social communication skills. Social communication skills that were taught during this intervention were social engagement, language, imitation, and play. Project Impact Intervention was provided to parent-child participants for 1 hour per week for a total of 12 weeks. Both the intervention group and the community comparison group were assessed at the baseline and also assessed 12 weeks from the baseline. In the initial session, therapists administered assessments and described the goals of Project Impact, as well as the interactive and directive intervention techniques and any social communication techniques that the parents or caregivers could use. Over the next 10 sessions, therapists taught parents interactive and directive therapy techniques. The interactive techniques were used to enhance the child's motivation and engagement while also providing language to the child. Directive techniques were used by the parents through prompting and reinforcement to increase the child's complexity in their responses. The final session consisted of the therapist administering assessments post-therapy, as well as a plan for the parent-child dyads to continue intervention techniques at home.
Bobby, a 3-year-old male with autism spectrum disorder, attends speech therapy 2 times a week with his mom. The SLP is implementing Project Impact goals into his therapy sessions. During a structured play activity, the parent and child will play with a car ramp with cars and road signs. The parent will follow the child's lead and provide language techniques such as modeling and expansions to increase the child's communication and engagement. The parent and clinician should record the child's responses to the language techniques.
One of Bobby's goals is to use 1 to 2 word utterances to comment within a structured play activity, following models and expansions provided by his parent or caregiver in 4 out of 5 trials with minimal verbal facilitation. During the therapy session, Bobby pointed to the car and the parent modeled, "Go car," Bobby did not respond to the model and continued to point to the car. The caregiver picked up the car, placed it on the ramp, and modeled, once again, "Go car," while pushing the car down the ramp. Bobby then picked up the car, placed it on the ramp, and responded, "Go car."
This article is clinically relevant because it shows that parent training interventions such as Project Impact in community-based settings are effective when trying to enhance social communication skills in children with autism spectrum disorder.
Thanks for watching. Bye.